The mental health diagnosis I have been assigned is anorexia nervosa. Anorexia is an eating disorder which involves individuals obsessing over what they eat or their weight. The assessment I chose to perform is the Eating Attitudes Test, also referred to as EAT-26. EAT-26 is in fact the most widely used assessment tool to measure the severity of a person's eating disorder. The purpose of this screening measurement is to better understand a person's disorder and determine whether or not their condition needs professional treatment. This assessment tool examines symptoms associated with eating disorders and common characteristics that can cause concern for the well-being of the individual. Originally, the Eating Attitudes Test was a 40-item assessment tool. This assessment was revised in 1982. This revision decreased the length of the assessment and updated the present version to only 26 items. This assessment can be used on just about any population, any individual regardless of age, gender, or comorbidities. In short, anyone who is at risk for an eating disorder can take this assessment. The EAT-26 can either be self-administered or given by a professional. Health professionals, school counselors, coaches, camp counselors are all recognized as often administering the assessment. This assessment can be given at schools, physicians' offices, extracurricular organizations, and camps. It is important to remember that the EAT-26 cannot diagnose an eating disorder on its own. There is actually no known assessment that can diagnose an eating disorder. To this day, a healthcare professional is required in order to diagnose an eating disorder. Instead, this assessment serves as the initial step in a twofold screening process. The second step would be to meet with a healthcare professional for an evaluation. If an individual scores 20 or above on the assessment, they should be seen by a professional to determine whether or not an eating disorder diagnosis is present. A score below 20 is considered a low score. However, this does not mean they do not have a serious eating problem. Individuals in this range are still encouraged to seek professional help. The assessment contains 3 categories: dieting, bulimia, and food precaution, and oral control. Scores for each category are obtained by adding all the items from the questions assigned to a given category. For example, the dieting scale includes questions 1, 6, 7, 10, 11, 12, 14, etc. The creators of the EAT-26 hope that by administering this assessment early on, patients begin to seek treatment in the early stages of their diagnosis. It is important to make note that this is a self-reported measurement, which means the impact of the assessment is dependent on the client providing honest responses. With that, participants might be in denial, which can prevent them from answering truthfully. Many studies have been conducted to evaluate the effectiveness of the EAT-26. Research has found that the EAT-26 is a reliable and valid instrument as an objective measurement to better understand symptoms of anorexia nervosa. Another feature of this assessment tool is that it is very cost-effective and economical to be used in practice. Researchers Yoon and Funk examined the validity and reliability of the EAT-26 among college women. Their study found promising validity. However, they did express concern on the validity of the assessment among different ethnic groups. They feel additional research must be conducted before drawing any conclusions. Now we will have a demonstration of the assessment being administered to my patient, Alyssa. Alyssa, today we are going to fill out the Eating Attitudes Test. I'm going to read you the instructions and then I'll have you fill it out. But if you have any questions while you're taking it, you can just ask me. Okay. So this is a screening measure to help you determine whether you might have an eating disorder that needs professional attention. This screening measure is not designed to make a diagnosis of an eating disorder or take the place of a professional consultation. Please fill out the below form as accurately, honestly, and completely as possible. There are no right or wrong answers. All of your responses are confidential. There you go.
I a question about 17.
Okay.
What are diet foods?
So that could be any type of like bar or meal supplement smoothies.
Oh, okay.
Okay, thank you. So as you can see, Alyssa completed the assessment on her own. If the client is unable to do so, the clinician can read the answers and fill in the client's answers. Alyssa is finished and I have scored her assessment. Alyssa has received a 47, which puts her at a very high score. A score above 45 indicates that this patient is at a very high risk for eating disorder and weight concerns. As a clinician, I would explain this score to my patient and encourage her to seek further care from a professional specializing in eating disorders.